So, for this week's assignment, we were asked to choose between a few of the proposed treatment interventions for a dual diagnosis client. And I had to remember that that was the specification was a dual diagnosis mental health and substance abuse client because I was leaning towards a few different programs, but my answer changed based on paying attention to that caveat because those clients who have a dual diagnosis are facing very unique circumstances that are individualized, and they need treatment that is very tailored to their specific needs as they relate to their mental health and any substance abuse or substance addiction that they might be facing. So I originally was leaning towards a strengths-based approach and wanted to choose the problem-solving skills training. However, I don't think that that one fits best for a dual diagnosis client. And then for a brief moment, I was considering outpatient family-based interventions, but a lot of the times I feel as though personally, from what we have seen and what we've learned about substance abuse is either genetic or is an unhealthy coping mechanism based off of family dynamics. So I ruled that one out. And now that I've given you the options of the ones that I was leaning towards, the overall intervention that I chose would be most effective would be case management because it's a case-by-case basis, working within the fractured systems that we have. Each client would have an individualized treatment plan, which I think is the part that's missing from a lot of these group therapy aspects. While yes, a group environment can be helpful, a lot of the times I think that a dual diagnosis of very specific mental health disorder and a very specific substance abuse disorder can you don't treat the same depression in everyone with the same medication, and so the intervention shouldn't be the same either, and neither should the treatment. So I think that case management is actually the most common sense option in my opinion, but I'm looking forward to seeing any differences of opinions. I liked the description on the slide that we had that I'm reading off of now that said that it includes 6 primary functions of identification and outreach to people in need of service, assessment of specific needs, planning for service, linkage to service, monitoring and evaluation, and advocacy for the client system. What I like about that is that it carries the client through from start to finish. There's no abandonment. There's no you're on your own or like this, drop you off at juvenile justice and you're somebody else's problem. It shows that the clinician cares about the client, which if you think about it, especially if we're talking about youth, which I'm just going to assume that we are based on the chapters that we reviewed, when you're talking about youth, a lot of the times they are dealing with substance abuse because they are coping with their feelings of abandonment. In all of the videos that we watched this week, a lot of the youth discussed their parents not being present for them. And so I think that that is a strength of like seeing it through from start to finish and like progressing with that client and being an area and a beacon of hope and support for them. So yeah, that's where I landed was case management. And I am looking forward to thoughts, feedback, and reviewing other classmates' videos.